Hey everybody, welcome back to the show. Can't wait to get into this Cabral HouseCall. This is our second house call of the weekend. Hopefully you got to tune in yesterday. That was episode 3228. And if you'd like to follow along today, just simply head on over to stevencabral.com/3229. We're going to be getting into about 5 to 6 amazing questions. I'm just opening up the document now that my team does such a great job curating and putting all of these together, making sure that we don't have any duplicates. Remember, if you wrote in a question, no need to write back in. We got it. It just takes about 10 to 12 weeks for it to be read live on the show. That's just the queue that we have right now. But if you ever want same day answers, head on over to cabralsupportgroup.com. Free Facebook group, but private. And so you can just click to join. We'll let you in and just play nice, as we always say, play nice, and just be supportive of others. Others will support you. We answer your questions. Always happy to help. All right, let's dive into today's show. First question, just make sure I'm in the right place. All right, we've got Varun first. Hi, Dr. Cabral. I'm a 43-year-old male. I've been using a continuous glucose monitor to monitor my blood sugar levels the past few weeks. I noticed that blood sugar levels remain within range, fasting and after 2 hours. However, whenever I do high-intensity workouts fasting, my blood sugar levels spikes very high. It takes around 2 hours or so for it to come down. My general practitioner couldn't explain why this is happening. Have you seen this kind of phenomenon in your practice or research? I have a predisposition to type 2 diabetes in my family. Therefore, I eat clean, mostly plant-based. I do 45 minutes high-intensity exercise, weights, workouts 4 days a week. I do Equal Life Detox a couple of times a year and did the Parasite and CBO last year. All right, great question. Happy to help. I have multiple podcasts on this on fasting. You will find them at stevencabral.com/IF. That takes you to all of my fasting shows. So this happens anytime the body is under a great amount of stress. When you shift to high levels of producing glucocorticoids, that means cortisol, the body will then take sugar that you didn't even eat, but it will take it from your liver where it stores it and bring it into your bloodstream artificially, or not so artificially, raising your blood sugar levels. Or if you broke down enough liver glycogen after a fast, it will break down muscle tissue, which of course we don't want, and bring that stored glucose into the muscles. So this happens and is a natural process of the body when you get under too much stress. It can happen by drinking caffeine on an empty stomach for some people. That's why always, you can kind of see it happening now. But again, I didn't make any of this stuff up. I just want you to know that. I learned this from Ayurvedic medicine many, many years ago. The coffee, if you're gonna have coffee, you try to have it after a meal or with the meal in the morning so it doesn't give you as much of that big spike. Okay, so it seems to be the high intensity interval training might be just a little too high intensity for you. And it might be something that you only want to do once a week or twice a week, or you might want to have a little bit of food before that workout, potentially helping to buffer some of that stress, not maybe allow cortisol levels to arise as much, and maybe find that happy medium between cardiovascular based work and also some strength training. All right. So hopefully that was helpful. Matt's up next. Hi, Dr. Rawl. Thank you so much for sharing your knowledge and the results of all your hard work. I have high confidence that I have untreated dental infections over the years, and I've heard that this can affect heart and brain. In regards to the impact on the brain, what can I do at this point where the damage has already been done to stave off, if not reverse, the consequences? All right, Matt, thanks for the kind words and thank you for writing in. So, untreated dental infections over the years. Now, that does mean, though, that you've treated them, right? That you worked with them. And now that I use the word treated, I have to say I can't provide you with any medical advice, medical treatment plans, medical cures, or medical diagnosis. All right. But Matt knows that. Everybody knows that. Okay. So you've gotten them fixed. What happens is this. Think about this. You get a root canal, and under that root canal, over months or years, bacteria begins to build up. That bacteria then gets into your bloodstream and can affect the heart, just as Matt was saying, maybe sometimes the brain. Cause autoimmune issues, cause all sorts of inflammation in the body. Not good. So you get those dealt with a really good biological dentist, and then you've kind of fixed the root cause, which was the bacteria there that was building up. They use ozone treatments, they remove it, they can put in a much cleaner replacement I've talked about that on previous shows as well. It's very, very important. It's very important. This is oral dental health is greatly overlooked in terms of overall health. And I always recommend having your mouth looked at least once a year by a biological dentist. And they can be your regular dentist. That's who I use. So Harmony Dental in Boston, Dr. Torgu is who I've used as my dentist and my family's dentist for many, many years. So shout out to her. And there's many. You can just go to iaomt.org and you can find a practice near you. All right. So what else? Okay. So now here's the thing though, Matt, I personally, if I were you, I wouldn't be worried about your heart or brain because the body is able to heal. So as long as you're getting the nutrients that your body needs, the vitamins, the minerals, the omegas, the amino acids, etc., the body will heal. It really will. And then also doing detoxifications. Are you doing your 7-day Equalife functional medicine detox? Are you doing have you done a heavy metal detox? Have you seen if you have gut-based issues? So if you can, you run the Big 5, stephencabral.com/big and the number 5. You'll see all of your deficiencies and toxicities, and then you work on those. So I personally, I get what you're saying. I understand. But everything is fixable in the body. It really is. Unless there's an actual deformity that occurred, like with rheumatoid arthritis, and you have now like a deformed joint, that does happen, right? And so we can get rid of the pain, but the joint may not necessarily go back to its same shape. But I think you're going to be okay, man. I'm glad that you did the work and that you're focused on your health. So keep up the great work. All right, Ryan is up next. I went over 30 years without having jock itch. Then I got it self-diagnosed about 7 months ago. I treated it with over-the-counter medication to clear it up, but it has now been recurring. In the past 7 months, I probably had 8 to 9 bouts of it. What could be making me more susceptible to fungal overgrowth all of a sudden? Okay, yeah, great question. So this can happen to the foot. It can happen in the groin. It can happen under the armpits. So this is not uncommon. So what happens is the area can get any area that can be sweaty or moist and is typically in a covered spot can allow for fungal-based overgrowth. So the goal is to, of course, remove it, but also help with the immune system and the skin biome, right? We often talk about the gut microbiome, but we don't always talk about the skin microbiome or skin biome. So this is most likely, again, I'm not giving you a medical diagnosis. You're using whatever medication you have. Then it's knocking it down, but not completely eradicating it. And then you let it be, and it slowly starts to grow back. That's typically what's happening, right? Or not always, but again, I'm just giving you a scenario. So what we need to do, and I don't know what you're using for over-the-counter, but there's a lot of antifungals. So what we also may use with that is first apple cider vinegar. So apple cider vinegar, or just regular white vinegar if you want, can tonify the skin. We prefer just raw apple cider vinegar. And it allows as an antimicrobial, antifungal, antibacterial. So it's low pH, can help kill whatever's there. Then coconut oil can be great to use for a few days to a few weeks. Not a large amount because it can stain. It is an oil, but it will help keep fungus knocked down in that area and not allow it to grow. Then we recommend running at least one lab called the Candida Metabolic and Vitamins Test to make sure you don't have gut issues where you also have yeast and fungus growing inside the body that may be affecting the overall immune system as well. So that's absolutely where I would start. I would start with the starter kit if you can, the vitamin tox test. And you can find those at stephencabral.com/shop. That just takes you over to Equalife. And then the last thing is you can even add a couple drops of tea tree oil to the coconut oil and mix it together because tea tree oil can be really strong on the skin to help kill any fungal-based overgrowth there as well. All right. All right, Kristen is up next. Hi, Dr. Cabral. Thank you for all the great free content you put out to the public. You're very appreciated. Thank you, Kristen. Appreciate that. Kristen says, I've been struggling with mild to moderate acne for many years. I have tried pretty much everything. My diet is very clean, and I always have a very healthy lifestyle. I've seen many doctors and estheticians for this. I previously took out dairy for about a week to see if it was causing it, but nothing changed. I'm very mindful of minimizing glucose spikes as I know that can cause acne. I'm really hesitant to start taking out foods and eliminating things. Should my next steps be to get a continuous glucose monitor to see if that is the cause? I know there are many episodes on this topic, but I feel like I'm doing all the things. Thank you so much. Okay, yeah, happy to help with this. So basically, in adults, we see acne a lot of times from hormones, from food sensitivities, not as much from blood sugar alone. It's how it affects hormones from there. And then bacteria, food sensitivities, and hormones. Those are the main ones. So, and that includes gut-based issues as well. Here's the thing. Taking dairy out for 1 week is not enough of an elimination. And I'm not saying that it's that. Well, let me just give you, if I were you in your position, this is what I would do. If whenever possible, I would run the big 5 labs because I'd want to see not enough omega-3s, so there's too much inflammation. Like that's a reason, right? Stress, mood, and metabolism test. We would look at hormone levels and cortisol and high levels of estrogen. Is that the reason? So, because right now we're always going to guess, Kristen, unless we test. That's the truth. So I would run the big 5 labs. If you can't run the big 5, I would run the stress, mood, and metabolism test, and then the Candida metabolic and vitamins test. And then I would run the minerals and metals test. So that would be the order, and then I would run the inflammation, and then I would run the food sensitivity. Because after that, here's why. I'm going to have you do the 21-day functional medicine detox. And I'm going to do that because if your acne gets remarkably better after 21 days, doesn't mean it's all gone, but remarkably better, it's most likely a toxicity issue, potentially some gut, and a food and a food that's triggering this, all right? And remember, food sensitivities don't always show up as the immune ones of the food sensitivity test. They show up as digestive-based issues, okay? So, and just letting you know, the main ones we see are dairy, eggs, corn, soy, yeast. What's the one I'm leaving out? Eggs, dairy, gluten. There we go, gluten. Okay, so those are the main ones we see, but we eliminate those during the functional medicine detox. 21 days is great to do anyways. You have your fasting days, get rid of some of that bacteria that's building up in the body. So that's what I recommend. All right. All right, let's get one more question. We've got time. Let's do this from Jennifer. Jennifer says, hi, Dr. Cabral, what are your thoughts on organic soy milk that is only made from water and soybeans? I've heard from lots of doctors online that it's the best plant milk as it helps prevent certain types of cancers like breast and prostate and is a good source of plant protein. Thoughts? Okay. So I'm not a huge advocate of nut milks. I'm just not. Is a little bit fine? Yeah, no problem. Like if you were to put a little soy milk, like let's say you're postmenopausal and for a male, you're 45, 50 plus. The research does show, so I'm going to be honest, the research does show that some soy, which contains plant phytoestrogens, can be partially protective for breast and prostate-based cancer. So not disagreeing with that, right? Not disagreeing. 2-3 times a week, right? So here's the issue. Soy milk, for the most part, is soy protein isolate. Not always, but just letting you know, it's different than an organic, non-GMO, which of course, organic is always non-GMO, fermented tofu, right? So tofu is soybeans basically smashed up and made into a curd, like a soy, made into tofu, right? So that has been shown to be more protective than I believe soy milk. Now, it's all in degrees, right? That's why these things are a little bit nuanced. I'm not recommending soy milk to anybody in my practice, but if you were to say, I just use a little soy milk in my coffee, I'd say, yeah, probably no problem if you're not reacting to it. Now, some people in my practice absolutely react to soy milk. I react to soy. I don't do well with it, but other people may do great. So I don't recommend things that only work for me, like a lot of people do. I recommend what works for the individual. So I would say err on the side of caution. In small amounts, I have no issue with it. In large amounts, I'm not a huge advocate of soy milk. Like if you're taking 8 to 12 ounces a day and putting it in your smoothie, it could be just fine for you. So that's what I'm saying. It could be just fine, but also it may not be because that could be a larger amount of soy protein isolates than you would ordinarily get, even from consuming the whole soybean itself. So hopefully that was helpful. Again, it's based on the individual, and I always want you to do what is best for you, and that's why I can't give you an exact instruction, but that's how I look at it. So hopefully this was helpful. Thank you so much, everybody, for tuning into the show. I appreciate you. I thank you. I'll be back tomorrow with a brand new Mindset and Motivation Monday. Take care. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.